Hi, I'm David Brittain. I am the Managing Director at the Albert Cellular Therapy Transplant Center in Pretoria, South Africa. The Medical Director is Andrew McDonald. Vincenzo has requested that I give him some of the tidbits of our JC accreditation, which of course he helped us to obtain now more than 6 years ago.
How many transplants do you perform during the year?
We are doing about 10 transplants a month, so 120 a year. Maybe 40 to 50 are autologous, mostly multiple myeloma, with the rest lymphoma patients, and then a few acute myeloid leukemia autos. And then we have the rest are a mixture of matched related donors, matched unrelated donors, and haploidentical transplants in about equal proportion, I would say. Maybe 30 or thereabouts. 25. South Africa is about 60 million people, pretty much the same size as Italy, but obviously the geography is much bigger. I think we'll fit Italy into one of our smallest provinces, Gauteng. So the country is maybe 2,000 kilometers lengthwise and about the same across the breadth. So a big space and a lot of variability in density of the population. Also, we have a broad variability in the socioeconomic status of the country, and also the genetic variability. I mean, we have people, we are called the Rainbow Nation, and we have people from all different walks of life, different colors and ethnic backgrounds, religions. So we have a very diverse population, which of course has its own challenges in transplant medicine. Yeah.
And what are the benefits of the accreditation? Because now your center get the JC accreditation, no? 2 times. And if you can tell me 2 or 3 important points in the accreditation.
So I think the accreditation has been a huge benefit to us. Firstly, with any team of people that is working, to have a certain set of standards where you decide how you will manage common problems, etc., gives a platform for you to operate within, and a framework and a structure that you can operate in, so that decisions are not being made on an ad hoc basis. That for the vast majority of decisions, they are pre-thought and structured, your approach to many things. And where recurring problems are identified, you will change your protocol to manage them. And on that basis, I suppose the management of exceptions and incidents and adverse events and recording that and problem solving it. So I think one of the common problems in medical situations is that you have many people that are highly qualified and very intelligent. And so the risk is that you solve this problem today, and tomorrow you have to solve this problem again. And I think by having a record of adverse events and recording them and analyzing them, you solve today's problem, not only today, but in the future again. You prevent it from becoming a recurring problem. So I think that is probably one of the biggest benefits of the accreditation process. And then we don't do more transplants. I mean, we do pretty much the same number of transplants that we used to do, but I think we do better transplants. We've analyzed our outcomes, and just as many people have published, our outcomes are improved by around about 10 to 15% compared to before our accreditation, and some of that is improved selection of patients, and some of that is improved management of patients. So there's your 3 good reasons to do the accreditation, Vincenzo.
The people that are working in the hospital, at beginning, how they received the accreditation, how they saw the accreditation. Do you find some problem at the beginning?
So South Africa has 2 healthcare systems, really. One is a public healthcare system, which is familiar to many people in Europe. Many areas in Europe run on a similar system. And we also have a private healthcare system, very much like the United States. And my center operates in a private healthcare system. And what's important about this from an accreditation point of view is that there are many different service providers that operate in the same system. So For example, the hospital manages the patients, the nursing care and the facility is managed by the hospital group. Okay, the pharmacy is managed by a separate oncology pharmacy that specializes in oncology drugs, and the laboratory, the routine service laboratory is a separate unit. The radiology services are a separate unit. We ourselves, our clinical unit is separate, and we also incorporate the apheresis and the processing unit as part of our practice. But essentially, the nephrologist and the cardiologist and the infectious disease specialist, these are all separate practices that have to be incorporated. So having the standard meant that we could firstly give people a focal point that they could participate in, but also the requirement for service level agreements meant that everybody had to agree up front that this is what we were going to try and achieve, and that this is how we would interact with each other, that we would guarantee a certain... So I think it gave us a platform that we could interact on and that, that we had to commit to it. And so you asked, was there resistance to it? In fact, quite to the contrary, I think that there was great enthusiasm for it. I think that it gave everybody a focal point. They shared the vision already to look after patients, and to have the standard pegged and to be evaluated was a challenge, but it was also, and there was an enthusiasm for it because people could see even before we did it, the benefit that we would have derived from it. And I think particularly in dealing with the hospital group, there's a central kind of board and management, but the people on the ground have to manage and implement things on a constant basis. So having the standard meant that the local people had some degree of authority over the maintenance of the air conditioning services, for example, or the implementation of certain standards with the kitchen, which is subcontracted out to another service provider. So I think the accreditation, if I could explain it, isn't really a kind of mountain that you have to climb and a whip that needs to be held over you, but rather a focal point to direct energy and to garner commitment from the various participants. And I must say, we had a great enthusiasm from the various role players, from the nurses and the cleaning staff right up through to the outside service providers, the radiology department, and the various different physician specialists. So it was good. Yeah.
Okay, very good. Thank you very much.